Hi, I'm Phil Woodland, and this short video will explain what esophageal mucosal impedance is and what it means. The esophageal mucosa is made of a stratified squamous epithelium, quite similar to the skin. This is able to act as a defense mechanism, protecting against the noxious components of gastroesophageal reflux, such as acid, pepsin, and bile. If this barrier is disrupted, the epithelium may become more permeable, potentially allowing these noxious components to access its deeper levels. In gastroesophageal reflux disease, including non-erosive reflux disease, we can see an increase in the space between the epithelial cells under electron microscopy, something called dilated intercellular spaces. In fact, we can show experimentally that exposure to acid increases the permeability of the esophageal mucosa. Biopsies are placed in the specialized chamber and exposed to acid. Electrical resistance can be measured using voltage clamp techniques and applying Ohm's law. When neutral solutions are added to the chamber, a baseline resistance is found. Changing the solution to an acidic solution causes the mucosa to become more permeable, allowing easier flow of ions and a fall in resistance. All of this may seem unnecessary science, but it helps understand baseline impedance. Impedance is a technique that is used during reflux studies to help identify reflux events regardless of their pH. A series of electrode pairs are positioned on a catheter, and impedance to current flow between the electrodes in each pair is continuously measured. The easier the flow of current, the lower the impedance. When a reflux event occurs, an ionic liquid surrounds the electrode pair, allowing easy flow of current. This impedance change helps visualize a reflux event starting in the distal esophagus and moving proximally. In the empty esophagus, when there are no swallows or reflux events, the catheter is lying up against the mucosal surface. In this situation, it's the mucosa itself which is conducting current. Here we are back to the principles of the Ussing chamber experiment. If the epithelium is more permeable, ion flow can occur more easily and the impedance will be lower. We saw earlier that acid exposure increases the permeability of the esophageal mucosa. And indeed, several studies have shown that baseline impedance of the esophageal mucosa is lower in patients with more severe reflux. This change is most dramatic in patients with erosive esophagitis or Barrett's esophagus. There is somewhat more overlap in the basal impedance of patients with functional heartburn and non-erosive reflux disease. The mean nocturnal baseline impedance, or MNBI, is now the most commonly used method of determining baseline impedance. Periods of stable baseline impedance taken during the night are measured and averaged from the distal impedance channel. This method also shows that impedance is lower in more severe gastroesophageal reflux disease. A baseline impedance of less than 2,292 ohms in the distal channel has been postulated as an abnormal cutoff. Although not diagnostic in its own right, a low baseline impedance has been suggested as an adjunct that can be used as supportive evidence where the diagnosis between functional heartburn or non-erosive reflux disease, for example, is uncertain. Because baseline impedance is reduced in any situation where epithelial permeability is increased, impedance is lower in other conditions which cause inflammation of the esophagus. Most noteworthy here is eosinophilic esophagitis. Baseline impedance is markedly low in EoE. Because the quality of the baseline impedance is dependent on good contact with the mucosa, new devices have been developed, such as this balloon catheter with impedance segments attached. In summary, mucosal impedance is a surrogate marker of mucosal permeability, and it's reduced in proportion to the severity of injury in gastroesophageal reflux disease. Reduced basal impedance is also seen in other inflammatory conditions such as eosinophilic esophagitis. Although it's not a diagnostic test in itself, it can offer important information to help us decide on diagnosis and management in our patients.